This is Larry Tenenbaum. I'm glad to have this opportunity to contribute to this program and talk for a bit on artificial intelligence and image reconstruction. As you know, artificial intelligence is already having an enormous impact throughout the imaging enterprise, everything from utilization management and clinical decision support, fueled by natural language processing and an ability to scrape the medical record, things like scheduling. We did a very in-depth evaluation of a no-show a project, and we found that there were multiple factors, frankly, too many for humans to look at, that contribute to no-shows and give us the opportunity to anticipate and devote attention to those things. We'll talk a bit about image reconstruction during the course of our presentation, but as you probably know, AI is really, really good at segmentation as well as detection and quantification. And it is already raising human capabilities beyond where they would go on their own. In other words, the combination of man and machine being greater than man alone. Can also be used for reporting, giving summaries of reports, or even potentially doing reports at different grade levels or for different physicians. And of course, it can also do things like optimize billing, ensure that follow-up recommendations follow established guidelines and the like. But we're going to talk today, for the most part, about iterative reconstruction and deep learning-based image reconstruction. As you know, iterative reconstruction has been around for a while. It started in CT, and it allowed us to use doses that were really much lower than we had beforehand. So low that if you did an image like with the older techniques, which we generally refer to as filtered back projection, the images were untenable. But as you know, with iterative reconstruction, you can take that same image and turn it into an absolutely gorgeous state-of-the-art image, and again, still maintain the lower doses that we're accustomed to seeing today. Problem with conventional iterative reconstruction techniques is that they make some significant alterations to the image. One, as you can see from this slide, filtered back projection on the left and different forms of iterative reconstruction on the right. You can see that there is a variance in the way these tissues behave or these materials behave, across the spatial frequencies that doesn't occur with filtered back projection. So there is some fundamental corruption of the image that goes on with conventional iterative reconstruction techniques. And if you look at the noise power spectrum, you can actually see that there is a significant shift to the left with iterative reconstruction techniques. It doesn't occur with filtered back projection techniques. What that means is that you're going to get alteration in the texture of the image, which some people have complained about, and certainly represents a corruption compared to what we're used to. Now, these days, we have deep learning image reconstruction available from a number of vendors. From Philips, we have Precise Image, and the other ones you can see on the screen. And essentially, Precise Image was trained from, in the typical fashion, the way you would train using a neural network. It takes a high-dose image. It then works in an iterative fashion to get the low-dose image to emulate the appearance of the high-dose image. And once trained, it actually can take low-dose images and maintain the appearance that we're accustomed to with high-dose imaging, which is a great thing. So what does deep learning reconstruction do for you that iterative reconstruction couldn't? It maintains the quantitative integrity of the image. So the Hounsfield unit numbers don't change, which I think is really important academically. It certainly enables lower doses than conventional imaging with filtered back projection, and even lower doses than with conventional iterative reconstruction. With those lower doses and massively lower noise levels, it encourages you to use thinner slices for interrogation. And of course, anytime you add thinner slices, there are always more slices, but you can certainly imagine many circumstances where you'd like thinner slices. It does all of these things while improving the low contrast detectability, and essentially our contrast resolution. And most importantly, when you do deep learning reconstruction, you preserve the image texture and the spatial resolution and sharpness. You don't give up any odd texture that we've had to suffer through with iterative reconstruction techniques. Here you can see a nice example loaned to me by Dr. Tim Stick, which shows that if you look in this upper right-hand corner, you see you have a high-dose study with a noise level that is typical for a high-dose exam. If you go to 10% of that dose, you see the noise levels go up quite a bit if we're using filtered back projection. With iterative reconstruction, you can bring those noise levels down, but you can't get to the level that you were with your traditional filtered back projection technique at full dose. Using a deep learning reconstruction, you can see you can create the same noise levels and get an image that looks almost exactly the same without any altered texture. Basically a generic benefit of of deep learning image reconstruction showing that you can use much lower doses and get the same noise levels without the altered texture. This experiment was done comparing iDose at full dose to precise image, the deep learning reconstruction, at 50% dose. So in other words, the precise image deep learning reconstruction was at half dose, whereas the iDose was at full dose. And you can see from this particular graphic that the deep learning image reconstruction at half dose was able to outperform the conventional iterative reconstruction technique across the board for sharpness, noise level, which generally turns into contrast to noise level, image texture, as well as artifacts. And that really is an enormous boost. So for the first time, we're offering a technique that lowers the dose that may actually even improve the image quality. Now, again, I mentioned that the quantitative integrity is maintained when we do deep learning reconstruction. And here you can see multiple dove phantoms with filtered back projection on the left, deep learning image reconstruction on the right. Again, thank you to Dr. Tim Stick from University of Wisconsin, a brilliant physicist working in this area. And you can see that the dope phantoms look exactly the same. The appearance is exactly the same. What this means is quantitatively, what is a 50 ounce field unit? A filtered back projection is a 50 ounce field unit in the deep learning image reconstruction. Now, if you look analytically at the information we get from precise image, looking at both the noise power spectrum, texture changes, and the MTF curves, spatial resolution changes, you see there is incredible collinearity between the filtered back projection and the precise image, which fundamentally means we are getting the same image texture, the same spatial resolution, but we get the amazing noise performance that I showed you just beforehand. Now, here are some examples that the folks for Philips loaned to me, which really, I think, illustrates the great principle. What you have on the left is a standard dose, standard slice thickness. In the middle, same standard dose at 1 millimeter. And you can see as you start to make the slices thinner to reduce volume averaging, the image starts to deteriorate. You lose your contrast resolution. Take a look at the right. You see there's an image there that maintains its gray-white differentiation. It maintains the noise levels. Actually, even looks like it might even outperform the noise levels of the standard dose at with iDose conventional iterative reconstruction. It makes a very pleasing image. Same thing you can see here on this image through the lower pelvis, through the hips. Again, standard dose on the left at 3 millimeter. Go to 1 millimeter in the middle. You see the noise levels come up. We go to 1 millimeter on the right using the AI-based image reconstruction. You see the noise levels go down, and we get essentially a gold standard image, but done at 1 millimeter at half the dose of the conventional study, which is really compelling. Same thing here, full dose, 1 millimeter on the left, half dose, 1 millimeter in the middle, and both done with a conventional iterative reconstruction, the iDose 4. And now compare that to the deep learning image reconstruction on the right. The images are sharp. They maintain appropriate noise levels. The contrast to noise is great. You can certainly see more variegation in that adrenal mass marked by the arrow. I think clearly very impressive image quality across the board. Another example, full dose 3 millimeter on the left. In the middle, we have half dose 1 millimeter with the conventional iterative reconstruction. You see the image starts to deteriorate. You start to question the value of looking at very, very thin slices. Yet when we use the deep learning image reconstruction here on the right, you can see we have really a gold standard image at 1 millimeter. And this really does sort of let your imagination roam for reading on a PACS where you're scrolling through images or looking at pediatric patients with smaller brains. I think all of these things are really very compelling. And you see the same benefit here. iDose, full dose, 3 millimeter on the left, iDose, half dose, 1 millimeter in the middle, almost unreadable, precise image, 50% dose, 1 millimeter, highly readable on the right-hand side. And just take a look at this pancreas case, which I think really brings the point home. 1 millimeter across the board, full dose iDose on the left, half dose iDose in the middle, and the deep learning image reconstruction on the right. I mean, honestly, this is a really gorgeous image. You can see this internal pancreatic architecture, the edges really well, really define them from the noise. It really is a remarkable set of images. Now, one last piece in my last 20 seconds. We all know the challenge with cardiac CT, with the discordance between the best phase to read the right coronary and left coronary, and the yellow arrow and the yellow circle mark the typical problem we have with right coronary disease, and reconstruction really suffers. Imagine if you could use the same deep learning technology to essentially look at the full cardiac cycle, look at the images, make the necessary corrections in the phase retrospectively, and correct that image beautifully, all done with no operator involvement and all automated. And frankly, this is a pretty impressive use of deep learning image reconstruction to do this automatically, to recognize those artifacts and essentially correct and make the images, again, more consistent, more reproducible, and more hands-off. So in my 10 minutes or so, I hope I've made the key point that deep learning reconstruction is a revolution in routine imaging, whether it's for CT or MR, but in CT, particularly maintaining the quantitative integrity, lowering the dose even further, encouraging us to think differently and use thinner slices and get better images that do not give up anything compared to our gold standard. I hope I've impressed you. It certainly has impressed me. Thank you for your attention.